Hello everyone, my name is Renee Padiernos and I am a rising second-year MPH student at UC Berkeley's School of Public Health Infectious Disease and Vaccinology program. It is an honor to be presenting the following study entitled Community Provider Treatment Practices for Gonorrhea and Early Syphilis in Baltimore City, Maryland. According to the CDC, rates of bacterial sexually transmitted infections, or STIs, continue to rise across the United States, despite the COVID-19 pandemic. For this study, we will be focusing on gonorrhea, or GC, as well as primary, secondary, and early latent syphilis, which we'll be referring henceforth as early syphilis, or ES. Incidence rates for gonorrhea and early syphilis in Baltimore City, Maryland, the area of concern for the study, has been precipitously increasing over the past 5 years. Along with implementing robust prevention and diagnostic strategies, public health organizations must also prioritize prompt and appropriate treatment in order to reverse the rising trends for these two STIs. Providing appropriate or CDC-recommended treatment within 14 days of diagnosis is critical to preventing disease sequelae, reducing onward transmission, and mitigating antibiotic resistance. This study is specifically focused on treatment outcomes for the two STIs at the level of the community provider. Evaluating community provider treatment compliance is key to ensuring that diagnosed individuals receive prompt, appropriate treatment, especially given drastic funding cuts to dedicated sexual health clinics. At this time, there is a gap in the scientific literature regarding the compliance of community health providers to STD treatment guidelines. To address this gap in scientific knowledge, the objective of this study is to assess gonorrhea and early syphilis treatment compliance among community healthcare providers in Baltimore City, Maryland. Baltimore City health providers routinely report positive cases of gonorrhea and early syphilis to the Baltimore City Health Department, or BCHD. For this study, cases between January 1, 2018 to December 31, 2019 were utilized to assess treatment outcomes for gonorrhea. For early syphilis, it was between January 1st, 2019 to December 31st, 2019. Treatment information was aggregated by healthcare provider. Investigators assessed treatment compliance by looking at the following performance measures for gonorrhea and ES treatment: percent treated, percent appropriately treated, and percent promptly treated. Next, treatment compliance for community healthcare providers was assessed against the following benchmarks: greater than or equal to 90% treated, greater than or equal to 90% appropriately treated for gonorrhea, or greater than or equal to 95% appropriately treated for early syphilis, greater than or equal to 85% promptly treated for both STIs. The analysis of this study comprises of summary statistics, including median, IQR for each treatment performance measure, and frequencies for treatment compliance measures. During the assessed time period, 6,439 positive cases of gonorrhea were diagnosed among 216 Baltimore City healthcare providers, with only 33.3% compliance among Baltimore City healthcare providers. The largest gap in treatment compliance for GC was observed at the level of documenting treatment. However, when treatment is documented, most providers report that the majority of their patients were treated appropriately and promptly. This data shows that when it comes to treatment compliance for gonorrhea, there is a huge gap in treatment documentation. This may be due to suboptimal reporting of treatment information to the Baltimore City Health Department or barriers to patients returning for treatment, whether this be at the level of the provider or the patient, or both. Therefore, improvement in gonorrhea treatment reporting is essential, and the health department resources must be allocated in assisting providers in linking patients to treatment. Between January 1st, 2019 to December 31st of the same year, 523 cases of early syphilis were diagnosed among 95 Baltimore City healthcare providers. The results in this table show us that for all of these providers, document treatment was observed. Nevertheless, opportunities for improvement lie at the provision of prompt treatment. For early syphilis, a large majority of providers met BCHD goals for treatment and appropriate treatment. This is in stark contrast to the results that was reported in the previous slide for gonorrhea. Therefore, intervention should focus on improving time from diagnosis to treatment. Future work will look at the effect of provider-level characteristics on the variability of compliance to STI treatment guidelines. This will help in the development of focused provider-level interventions to improve said treatment compliance. Data from this current study was used to generate treatment performance dashboards for community providers that reported data to the BCHD over the aforementioned assessment periods. In 2021, these dashboards were disseminated to the individual community provider. The evaluation of whether these dashboards improved treatment compliance will be forthcoming. These data were collected prior to the COVID-19 pandemic and may not be generalizable to current provider treatment practices in Baltimore City or in other settings. Analysis such as these may aid in the development of appropriate indicators for improving provider compliance with STI treatment guidelines. I would like to thank the following people: Dr. Jacky Jennings, Dr. Christina Schumacher, and Nicole Thornton. Thank you everyone for your time and attention. I hope that you have a pleasant rest of your day.